Paperwork is never.
All right, well, I think we have a pretty packed house, so we're gonna go ahead and jump right into our workshop this morning. Safe Streets for All is very exciting. I don't think that roadway safety in any realm is viewed as controversial. We want to protect travelers and improve our roadway system as much as possible. And right now we have an unprecedented resource that was passed as part of the Bipartisan Infrastructure Act to develop safe streets and road work plans and programs. And then there's billions of dollars of funding to implement those projects. It's our hope at the MPO that not only are we successful in developing an action plan that addresses safety concerns across all parts of our region and contexts of roads, but also that we use this process to incorporate safety into our future work so that we are more proactive about engineering safe streets and places moving forward and hopefully not having to go back and retrofit today's mistakes tomorrow. So with that, I'd like to turn it over to our project team that's been working on this. Thank you very much.
Thank you, Doug, for that welcome. I'm Colleen McHugh. I'm the project manager here at the DCHC MPO on our side. And I've been working closely with the Atkins team on this. And so at this point, I'm going to turn it over to Scott Riggert from Atkins to give the presentation. Thank you. Take it away, Scott.
Let me try that again. You guys can hear me, correct? Hello?
Yes, we hear you now.
Okay, just making sure. Okay, thank you. So as Colleen said, my name is Scott Rickert. I work at Atkins. I have actually written the scope for, and actually did the City of Las Vegas Vision Zero Action Plan. And so today I'm going to give you a little brief overview about what a Vision Zero Action Plan is and where this scope is headed. Colleen, you want to go ahead and start? So first, we're going to talk about transportation fatalities per year. Next slide. This slide I put together here is kind of striking. The reason why I put it together is I wanted to get an idea of how many people died in some major wars in the United States. As you can see, when you break it down per year, there's some really high fatalities per year. So in the Civil War, it's almost 43,000. World War II, it's 58,000, and it kind of drops off. However, if you want to go ahead and click, in 2021, there were almost as many fatalities on US roadways as there were during the Civil War each year. And in 2022, it was almost exactly the same. The reason why I bring this up is because we don't even talk about this. Most people don't have any idea that this many people die each year in the United States on roadways. And a lot of this can be prevented. Next slide, please, Colleen. To kind of give you a little perspective on some more recent tragedies, the number of people that died in 2021 and 2022, each of those years, it's the equivalent of one 9/11 every 25 and a half days. So imagine that. We have that many people die in traffic crashes in less than a month. And once again, this is just something we don't talk about enough. And then the other thing I have on here that I'm showing is 1 October. It's a local tragedy that happened where a guy shot up a country music festival. But that was big news here. It really affected this city. But this is the equivalent of 2 of those happening a day in the United States. And we need to really think about how we can change that narrative. And I think it's up to us as engineers and planners to do that. Next slide. The other thing about this is these crashes are disproportionately impacted. This is a figure from the City of Las Vegas, their Vision Zero Action Plan, and it really stresses how vulnerable users are affected by getting hit by a car. For instance, pedestrians are 8 times more likely to result in a serious injury if they're hit than someone in a car, and they're 15 times more likely to result in a fatality. And then it kind of goes down the line with motorcycles and bicycles as well. Vulnerable users are are things we need to look out for on our roadways. And if we look out for our vulnerable users and make it safe for them, in turn, we'll make our roadways safe for everyone, including vehicular drivers. Next slide, please. This is another figure illustrating how the vulnerable users are affected by getting hit by crashes. Within Las Vegas, almost 89% of all transportation is vehicular drivers. Very small percentages, such as walking, is 1.8%. However, when you look at the fatalities, that 89% of vehicular drivers results in 39% of the fatalities, where the 1.8% of pedestrians results in 37% of the fatalities. And it's very similar for motorcycles and bicyclists too. We do not, when we get hit by a car, there's that adage where if you get hit by a car at 20 miles an hour, you have a 90% survival rate. You get hit by a car at 30 miles an hour, you have a 50% survival rate. And if you get hit by a car at 40 miles an hour, it's a 10% survival rate. Most people aren't driving under 40 miles an hour. I think we all recognize that. So if people are getting hit by a car while walking or bicycling, there's a very likely chance that it'll result in a fatality. Next slide. Another thing that affects this is it's disproportionately affected within communities of concern. And these are areas where people tend not to have access to a vehicle and they need to be able to walk or bicycle or use transit to get to work or to the grocery store or school. These communities of concern tend to include low-income populations, people with disabilities, senior populations, limited English proficiency, and their minority populations as well. Next slide. So what's been happening is the United States Department of Transportation passed a bipartisan infrastructure bill that I think all of you, I'm sure, know about. It's the Infrastructure Investment and Jobs Act, known as IIJA, for $550 billion. 52% of this is strictly for transportation infrastructure. And that emphasis goes on safety, equity, and resiliency. And safety and equity are two words you'll hear a lot throughout this plan as you guys are part of this TAC and help develop it, because safety is obviously a major issue that we've been going over, and also equity. We have a lot of equity issues where some of the worst areas of town that aren't up to code are the areas of town where people need to be able to walk and bike. Next slide, please. Within this IIJA Act, there is an SS4A grant, which the DCHC MPO Vision Zero Action Plan came from. It's for $5 billion over 5 years. Their goal is to give $1 billion each year, and it's awarded to support planning, infrastructure, behavioral, and operational initiatives to prevent death and serious injury crashes on all roadways, or for all roadway users. And this, I'll get more into this a little bit later, but remember, the death and serious injuries are the major things here. Next slide. So as I mentioned, and as Doug mentioned in the introduction, DCHC was awarded an SS4A grant to develop a Vision Zero action plan. So what is Vision Zero? For those of you that don't know, Vision Zero is a strategy to eliminate all traffic fatalities and serious injuries while increasing safe, healthy, and equitable mobility for all. It was first implemented in Sweden in the 1990s, and Vision Zero has proved successful across Europe, and it's now gaining momentum in the US. And when I stress once again on here, it's the serious injuries and the fatalities. Next slide, Colleen. And this is kind of where it goes into it. It is, what is the difference between our traditional approach and Vision Zero? In reality, it's more of a reactive versus a proactive process. The first one is traffic deaths are inevitable, where Vision Zero believes traffic deaths are preventable. And then it kind of goes down perfect human behavior, whereas Vision Zero's integrate human failing in an approach. Traditional approach is to prevent collisions, where the Vision Zero is to prevent fatal and severe crashes. This means that we recognize that there's going to be property damage only crashes that occur, but we want to make sure that the crashes that occur are only those types of crashes. We saw a lot of fatalities in the US, and those numbers at the beginning of this presentation, they are a fraction to the number of serious injuries. And the thing about serious injuries that a lot of people don't realize is you don't always see it, because it's not always a missing leg or arm. A lot of times it's brain damage. And a lot of people can't tell that person had brain damage that occurred from the crash, just by seeing them. It's not until they talk to them. Once again, traditional approach is individual's responsibility, where Vision Zero is more of a systems approach. And then the last one is traditional approach is saving lives is expensive, or Vision Zero says saving lives is not expensive. To give you guys just some quick numbers, I don't quote me on the exact number on this because it keeps going up, but one fatality crash right now costs over $12 million, just one. And I know that sounds crazy, but that's the reason I say that is because a lot of that money isn't borne on the people that were in the crash. It's borne on us and people that have to pay car insurance, right? Your car insurance goes up because there's crashes that are occurring in your neighborhood. And it kind of goes down. There's so many different levels of this where these costs come from, but it actually is more expensive to not make the changes to help reduce these crashes. Next one. So why we're here today is we helped develop the Vision Zero scope of work for the DCHC MPO. And I'm going to give you a brief overview of it. I won't go into major detail because you guys will have a chance to read it on your own if you haven't already. And in the end, we want to make sure that we incorporate all the things you guys want to see if possible, and get any comments you might have. We have a few questions for you at the end, but then also have a time at the end for you guys to ask questions to us. So starting off, what's included in this Vision Zero action plan scope of work? Well, number one is project management and coordination. As you can see, some of this stuff is pretty self-explanatory. So just project management. We're going to have internal kickoff and progress meetings. But where you guys really come into play is the coordination with the Project Technical Advisory Committee. You guys are the TAC, and your input is meaningful and it's needed. And then you look at the other ones too. You guys might be involved in the public information and neighborhood meetings. But then the other parts are the webpage, public surveys, and then board updates. Next page. For existing conditions, this is, we're going to review similar plans that have been done in locations that are near you, such as Charlotte. And then the other thing is we're going to be really getting into the crash statistics and trends. This is where I was showing you those figures at the beginning of the presentation that broke down how vulnerable users really are affected heavier by these crashes. And what we'll do is we'll develop what's called a high injury network. And what a high injury network is it locates the areas within the MPO's jurisdiction that have the most crashes. And what you tend to find out is, I'm just spitballing something out there, but you might have 90% of crashes only occur on 10% of roadways. And so you can focus on those roadways. And then eventually what you'll do is you'll integrate the communities of concern. And if those roadways are within communities of concern, those are the areas you want to focus on first, because they're the areas that need it the most. Next page. This one is defining Vision Zero and the MPO's vision, mission, and goals. Defining Vision Zero is what I've done initially, but the vision, mission, and goals is really what will be developed more than likely in the first TAC meeting. And there's some goals that are the initial goals that are listed within the scope, and we'll be hitting those pretty hard and focusing on those areas, but also more than likely adding more stuff and combining a few things. Next page. Test 4 is roughly what is included in the Vision Zero action plan. Obviously, some of the statistics that we talked about before will be included too, but this includes a message from the mayor and or council managers. The reason why I bring this up is having political support is key, because there are two different ways these Vision Zero action plans go. The ones that are successful have that elected official support. The ones that aren't successful, they don't have it, and you can really see it because they don't actually implement these safety projects within their city. The next one is remembering victims. It really gives people a chance to, if there's anyone, to tell the story about someone that died in a car crash. There's some crash reduction examples that we'll look into. It's always good to show that what we've done so far, or what the DCHC MPO has done so far. And then really we get into Vision Zero action plan needs, as well as benchmarks and the implementation plan. That's going to be a big portion of DCHC MPO and the TAC helping develop and craft those action items and how to move forward with this plan, because the goal is to keep this a living document. This would be the first phase of it. More than like, they tend to go 2 or 3 years in between each phase of the Vision Zero action plan. And then the last one is TJCOG, which is going to be called Central Pines Regional Council. They have a Making All Communities Safe in the Triangle action plan they want as well. And so we're going to look at ways we can combine the two or complement each other. Next page, please. The last part is just the draft report. And then, so what are our next steps? Well, the next steps after developing this plan, as I mentioned, it's you want to make it a living document, and you want to hold yourself accountable. That's why you want to be transparent about the results, and you want to find out what safety countermeasures you are implementing are actually working and keeping track of it. And then you're going to want to continue to update that, because the goal of these Vision Zero action plans is they tend to have a really long time ahead that we're going to set a goal of reaching this, maybe 2050. However, we need to make sure that we're continually changing things, because if we don't make these changes ourselves, being engineers and planners, nothing's going to change, because there's so many E's out there. And I was getting the fact of, yes, people can say we need more enforcement. That may be true, but a lot of police need more people to actually be on the road, right? They need staff just like we all need staff. And then the last one on here that we wanted to mention was, throughout the course of the project, we're hoping that the entities involved in the TAC will help develop a list of demonstration projects that the DCHC can use to go after the next phase of SS4A funding. As I mentioned, every year you can go after SS4A funding. There's nothing holding you back. So it's encouraged that you keep going after funding each year, because this money is available right now. Next page. So what I'd like to start out with, Colleen, did you want to take this part over, like just going over these questions, or do you want me to list them off, or how? Sorry, what was that? Okay, I can't hear you, so I can keep going. So the questions we have for this group include, what are your thoughts on virtual meetings? We have a very large group, and we understand having everyone in one room might be difficult. So if you're comfortable with the virtual meeting aspects of the TAC, we can develop that, or we can even develop a hybrid of it, have some in person and have some online, similar to what we're doing today. A few other ones that we want to go over are, how do you currently account for communities of concern? Are you using Justice 40? Do you have something within your own transportation plan, or what specifically are you using? Are there other organizations on the list of the TAC members that you guys feel like we should invite? And then if there's any other suggested scope edits or questions. Do we want to open this up to everyone, or how do we want to do this, Colleen?
Can you hear me?
Yeah, I can hear you.
Great. Or we were trying to troubleshoot the audio for a second.
Okay.
So at this point, I would like to open it up to, it looks like we have a few comments or questions in the chat. And then I would also like to open it up to those of us who are in the room. As I know, we've got a pretty great group of people gathered here already. So let's Let's do that. Let me take a look at what's in the chat and then, hopefully those of you who are online can hear what's going on in the room. And if you can't, please let us know. But at this point, go ahead, Doug.
And if just as you're called on, if you could, if you haven't introduced yourself already, if you could just mention who you are and your role in our community, that would be great. Because I think we have some people that aren't always in our meetings here today.
Thank you. So I see there's a couple questions or comments in the chat about wanting to have the slides post meeting. Absolutely, we'll be making these available on the MPO's website so that you can download and review them after the meeting. As far as a link to access the scope of work, it should also be available on our website. I can send the actual link in the chat while others are talking so that you all can go in and click on that and look at it at your leisure. All right, lastly, it looks like there's a question about a planning grant or a project grant. This is a planning grant.
Yes, I would like to mention, and one of the comments we got back from the safety staff at NCDOT was that if there are projects that come up during the planning process, we may be able to escalate those to action before we adopt or complete the action plan work. They have interim guidance about submitting test or pilot projects in advance of action plan completion. So I want our stakeholders to realize that if they have, as we develop safety priorities, we can advance those before the planning process wraps up.
So I'll start calling on
Let
people.
the others go first. I'll have my comments at the end.
Thank you very much.
Hey, just real quick, my name's Javier Caballero. I'm a Durham City Council member. I sit on the MPO, which is why I'm here. And I think for me, one of the things that I just need very clear as a decision maker is the money part. All of the other pieces, I feel like the city of Durham especially can do all that. We've done it. We have a proven track record. We have clear commitments to equitable engagement when we are out getting community feedback. That's been in place since 2018. It's the money piece. How do we fund these things at the end? And then I need actual examples that are relevant to Durham. So Charlotte's great. I need examples that are similar to us in the political context that we're in as a local community. So those are the parts that I need as part of the plan that are also really transparent with the community so that folks also understand how are we going to pay for the things that I think there is the political will, there is the community will. It's just the actual reality of resources.
Thank you.
Thank you very much. Sorry, I'm also busy copiously taking notes. So if I could ask Doug to help me call upon people too, as you see them in the room.
Sure, great. I see a hand back there.
Do we to come to the mic so people can hear?
That would be great.
Sure, please.
I'm John Talmadge with Bike Durham and really appreciate you opening this up to members of the community for conversation about the scope. While the identifying projects are really important, it seems like this is organized to do that. One of the early slides was about how this safe systems approach is a different sort of cultural approach to safety in the transportation decision-making. And so I think it's important that both in looking at what are the existing policies and processes and even institutional arrangements that have resulted in the system we have now that creates the deaths and the serious injuries. And then looking at what can be changed about that or worked on over time So that's one, and then the other is I'm seeing that there'll be an action plan from the MPO and for that's my vocabulary. Central fund. Will each municipality have their own action plan? Since that's really where a lot of the decision making about the project funding occurs. Those are the two things that I would suggest, and then I'll just call out that in Durham, most of the deaths and serious injuries are occurring on vehicles. And there's been a conversation about you want different decision making. You might need city of Durham may need to take responsibility for those roads. I think that needs to be wrestled with in this planning process. Is can either there be alignment with NCDOT and the municipalities on address these problems, or are we going to fund taking responsibilities for the municipalities? I mean, those are issues that I think aren't limited to Durham. I know that they exist in the other communities. Thank you.
That's a great point where, we can't promise we'll resolve all potential issues. Definitely having information and public education on those is valuable.
Looks like Kenneth has his hand raised online.
Yes, can everyone hear me?
Yes.
Perfect. This has been a good presentation and we greatly appreciate this. What I just wanted to basically share is from the capital area MPO standpoint, we're in the process. Of course, we have an RFP out for a modal safety action plan that we'll be looking to launch later in the month of September. And of course, we'll be doing coordination with DCHC, along with the fact that the city of Raleigh and the town of Knightdale also have their own Safe Streets for All grants that they are beginning to enact. The question that I have is that Bonnie, whom would be on the call, Bonnie Parker, who would be on the call, who was our public engagement officer, is sick. But what I wanted to find out is if someone could provide additional information as to the public engagement process that you all are looking to enact and how we can coordinate between Campo and DCHC to do things where we're working in coordination with each other and probably use the energies from both of our plans that we're looking to enact to ensure that the public really gets a good message and coordinated message on what we're attempting to do from a Safe Streets for All safety action plan. So I was wondering if anyone can talk about the public engagement process on the Durham side.
Thank you, Kenneth. Specifically, Scott, if you wouldn't mind kind of going, let me go back to that slide if I can. It's probably going to be hard to read for those of you online. Let's see, it's been number 2 or 1. So there, Scott, can you talk a little bit about the process we envision for public involvement? Because there are several different components to this.
Yeah, so public involvement is obviously key. I'm only showing on this, on this actual screen here, the small or the heading for it. Let me get to it real quick. I want to make sure that so what a big part of this SS4A grant is you need to get out to the public and talk to them, right? And we recognize this is a very large MPO area. Realistically, we probably can't have a lot of just in-person meetings at all these different locations because you're not going to get the foot traffic you want, and it's difficult to do that. So that's why within the scope itself, when you guys get a chance to look it over, it really details that the virtual meeting that actually having virtual public meetings is the main thing. And there's going to be at least a couple of them. And those include surveys, and it's really getting out to the public and asking the questions that the MPO wants to ask and what it wants to get answered, really. And that it's an opportunity to learn more about the communities and what they really need, and doing a and then there's also additional neighborhood meetings, as you see on the 1.4, that can be had. Those are easy ones to do online too, where you can have them with different community groups, HOAs, businesses, whatever. And it's really breaking that down and just getting to the public. When I did the first one that I worked on, it happened during COVID. So it was really hard to get people to come or even to go talk to people. So that's why we learned a lot of lessons learned using virtual meetings. And so so when you combine the virtual meetings and you combine the neighborhood meetings, the virtual public meetings, the neighborhood meetings, and the public surveys, along with having an actual web page to give updates, that's how we are really reaching out to the public for this one. I didn't go into super detail on the scope or too much detail, because I know because this is a scope that's still going to be released and go out to bid, or at least to get qualifications for. And so I want to make sure that it gives also competitors a little bit of opportunity to say what they want to do for the public outreach. But the public outreach is really a big key of this, because so many times we give the community what we think they need, but we don't always give them what they really want, or what they think, or what they need personally. We give them what we think they need. And that's where we need to break that. And really, I think we can really focus, we focus so many years on the vehicles. And yes, we do stuff for pedestrians and bicyclists, but that it really takes a back seat. So if we can change that and focus more on those peds and bikes, it's going to make everything safe, including the roadway for the vehicles.
Appreciate that.
Hopefully
Thank you very much.
Yeah.
One of our City of Durham friends.
So Bill Judge, Assistant Transportation Director for City of Durham. Just sort of following up on that, I would strongly recommend and advise on behalf of the City of Durham that, particularly as we deal with more of the community neighborhood meetings, that we utilize basically a tactic similar in spirit with our equitable community engagement blueprint. I know the MPO has utilized it on a number of other projects like US 70, some of the Durham County Transit Plan, to really make sure that we're targeting and reaching those neighborhoods. I think probably some of the other jurisdictions I'm not as familiar with, but I'm sure they can probably provide similar help or assistance. I think virtual meetings are fine for technical staff type committees or some of the larger, but really when you get down to those neighborhood type level meetings, we really need to have an intentional focus on who we're trying to address and hearing from.
Great, those are great points, Phil. Thank you. Burton.
Bergen Watterson, I'm the transportation planning manager with the town of Chapel Hill. And I'm really excited about this scope and excited that we're kicking it off. I think these are sort of echoes of sentiments I expressed when we were doing the application, that I just want to ensure that going forward that, you know, all of the jurisdictions are included and represented equally. That, you know, everything from, you know, these progress coordination meetings, that it's not just with the MPO, that it's with all of the, you know, staff from the local jurisdictions, things, you know, the mayor's statement, like, is that all the mayors? Is that one mayor? Is that, you know, how, just that it includes all of the jurisdictions. I had concerns about the neighborhood meetings sort of along with this same line that, you know, if you've got 7 different jurisdictions, how do you choose the 4 neighborhood meetings? I like the meeting in a box idea. I think that's really good, and I'm sure we'll use it a lot. Just really wanting to get down to the local level. I think in Chapel Hill, one of our main goals in this. You know, we already have a pedestrian safety action plan. We've adopted our Vision Zero resolution and we operate along those lines, but getting projects identified that we can then submit to for the implementation grant going forward. So just, I think we kind of envision, you know, having this MPO level plan that has the policies and the goals and all of that, but then really solid individual project plans for each of the jurisdictions, that doesn't get lost in the shuffle of an MPO wide plan. It came a lot to mind thinking about the high crash network in communities of concern. And again, I think in our environmental justice plan, we did do that relative to each county or jurisdiction. You know, if you look at it MPO wide, the city of Durham will have the entire high crash network so that we can make sure to get down to that local level of jurisdictions.
I think that's a great point. I like your suggestion about design the action plan, implementation program, reporting.
I think the tax, this is listed as tax, usually this is tax that's involved in this process, it's very thorough, very detailed. The town, the sheriff's office, EMS, the green inclusion, that will help engage in that public process and addressing community concern, as well as identifying projects that are not really infrastructure related, but actually enforcement, education and stuff like that, that we can pursue through the action, through that TAC process. That's very detailed and robust in this process. And we're including a very detailed list of who's all involved in each of the towns, each of the jurisdictions, from each of the various departments going to be actually implementing this process.
Sort of tag on one more thing on that. If possible, looking, so the MPO is the project manager, you know, we'll have a consultant, and sort of getting back to my initial comment about the 12 progress and coordination meetings, it says we'll be with the MPO and other relevant agencies. I think, you know, if it were my scope, and I know that it's not, it's all of ours, you know, we'd have the MPO be the point of contact with the consultant. In my ideal world, we would have them sort of a smaller project team that may, you know, similar to local staff from each of the jurisdictions, and then the larger TAC with all of their expertise and different perspectives, but sort of a smaller steering committee project team that can really, you know, that has that expertise, have worked together before, that can have more consistent contact with the project manager and the consultant.
Sharing my experience with the BGMPO side, either safety action plan, now they're in the implementation phase of that action plan, continuing to build upon the progress and that stuff that, you know, other offices, other departments that were involved in the original plan development, especially now taking the lead in it.
I did want to touch on one of the things that you mentioned, Bergen. So we had on there a very open-ended statement about who is going to be signing this. I believe one of our thoughts was all elected officials who are member agencies of the MPO would have the opportunity to sign it, or city manager, town manager, whatever that, either the case may be. That's something that we had identified as, Scott had identified as successful from the one that he had worked on in Las Vegas, and making sure that there's buy-in and
Local board approvals.
right.
To support the final plan.
Agreed. It just, if you can get every mayor to sign, or it looks good. I will say that. And it shows that they're on board. Because it also included within here is kind of a pledge by everyone on the TAC to just sign. And it's once again, it's just being held accountable for it and keep pushing the safety envelope.
Yeah, we've got a hand up in the back.
Yeah, a couple back there and.
Good morning, I'm Kristen Brookshire with Durham Public Schools. Haven't had a chance to review the scope yet. I understand the importance of doing the crash analysis, the trend analysis, and identifying the high injury network. I wonder if there's any room for identifying risk factors, because of course there's also the trips that are not taken. And so that can be done locally through using our crash data to find out what are those local risk factors, or, you know, cheaper, faster to use some of the ones that have been identified at the national level through some of the, you know, FHWA and different research organizations. And then One more thought is, once those high crash locations or high risk locations are identified, I just encourage the group to think about if there's a different toolbox or a different standard that we might apply when coming up with these projects, when it's near a school or another youth serving destination. And these are trips that students and families are making. So hopefully that can be a topic for future TAC meetings.
So I see there's a comment in the chat online. If those of you who are speaking in the room could speak into the mic, they're having a hard time hearing.
Oh, yes.
So on that note,
Thanks, Colleen. Good morning, Roger Henderson with the town of Chapel Hill. Wanted to echo John Talmadge's suggestion, and I don't know if it's possible to engage the consultant in this effort, but certainly NCDOT and sitting down, maybe having a user group within the larger environment. John was spot on. A lot of the problems are on major roads, and if we don't tackle that problem at some point and work together with DOT, we're not gonna make much progress. So I would love to be part of that process. I don't know how to make it work, but I'm happy to do whatever. So thanks.
Ellen Beckman, Durham County, I guess similar thoughts. I see that on the stakeholder list under NCDOT, we have like IMD, Safe Routes to School Public Information Officer, Brian Murphy, and Rural Safety. I hope the divisions would participate as members of the stakeholder committee. You know, that's really where a lot of project decisions get made. And the other thing, you know, I do think it's important to have recommendations that integrate this into the MPO's, you know, required processes, CTP, MTP, TIB, all that, right? Like that we are specific about how this is applied when those decisions are being made. And then thirdly, we're not the only MPO that got a grant in the state, right? I think Land of Sky out in Asheville and Greensboro, and then Central Pines. I don't know. Is that accurate? Those, and maybe more. I was just looking at the FHWA site. Like there's a mixture of municipalities and then like kind of planning organizations. I hope that like this could be an opportunity to have at least those planning organization type entities like talk to each other and come up with similar recommendations. Or at least share when it comes to like NCDOT, federal highway kind of actions that they're responsible for. And that, you know, could be powerful to have similar recommendations across multiple plans across the state. You know, that are, you know, how we can integrate this into the statewide and MPO, RPO processes.
You know, there is a Federal Highways brought on a staff resource to the North Carolina division specifically focusing on delivering these the grant processes. And I wonder if maybe they could help a coalition check in periodically statewide and you know, make connections, share successes and opportunities for improvement as we go through the action plan process.
so I did want to point out, we have had some additional comments in the chat. And I don't want those to get lost. It looks like there was a question about what Charlotte did and implemented. We can send out a link to that plan. I don't have it handy, but yes, they have a plan that we can share. There was also a question from Tricia about only 2 virtual public meetings across the entire MPO and wanting to have at least 2 meetings per jurisdiction. So making sure that we're doing plenty of public involvement. That's it.
And I you know, like to point out that as we got an initial award of $500,000 for this, and certainly if as we develop the scope, we feel like those resources may not be enough to cover the expenses of doing everything we want to do. There are additional opportunities to either submit for an amended award or to supplement some of the work with additional conventional MPO funding. So, you know, I think that we have an amount, it's a substantial amount, we can form a lot of engagement with that amount, but, you know, I don't want anybody to say, well, you know, we shouldn't do an extra engagement step because it might cost more money when we legitimately have resources that we can apply.
As a TAC is involved in this, would it not also help if the MPOs were to lead that process and the consultant lead that process and local districts is to help with that public engagement, like meeting in a box and other things that
Yes.
the local districts do the work as well as the MPO in it. But because I know in the TAC, you have community relations and public relations and other committees are involved in that TAC to help encourage and spread the word.
That's exactly it. And that would not only be great from a budgeting aspect, but also from an ownership aspect of the work, because the product's gonna be a lot more successful if everybody is collaborating on it. Because we have a hand.
Hi, Samad Ranganwala. I'm also with Bike Durham. So I wanted to highlight something that was kind of touched on earlier with regards to the high injury network. In the research that we've been doing, one of the kind of differentiating factors between a really successful action plan and the ones that just kind of get put out there and then ignored to some extent has been really investing in that early data collection. Montgomery County, for example, did this giant kind of study into what specific parts of their street network were causing injuries, whether that be like the width of the lane, curb radii, that kind of thing. And they have, from that, also developed a toolbox for safe streets design. And that allows them to not only look at currently dangerous streets, but also streets that might get more dangerous as traffic volume increases. As you know, this the fastest growing metropolitan area and like one of the fastest growing metropolitan areas in the country. So as streets get more busier, traffic violence might go up on streets that were previously safe. And so really investing in that data collection so we can take a proactive approach to some of these issues would be good to have in the scope development document.
That's a great point. It's not written, as we engage consultants on work, there are different ways to analyze the data that we have on crashes, including ways that we can estimate crashes that are underreported or not reported at all. And we believe that there's probably a high degree of that phenomena occurring in this MPO. So definitely, as different consultants suggest interest in this work, we'd like to hear from them in the selection process, what their recommendations would be for understanding those situations, and then examples of where they've applied those techniques in other geographies. Because we know that's out there. We know that, you know, different jurisdictions report crashes more effectively than or less effectively than others. And, you know, what we don't want to ignore the crashes that happen. And another key thing we'll do is we do have the trauma centers in the area on board. And so sometimes when the crash records don't accurately report the crash outcomes because they're, you know, at the time of the crash and not necessarily the follow-up, we may be able to on a global level understand the implications of those vehicle crashes through aggregate data at the trauma centers. So I wanted to point those things out, that we are proactively thinking ahead and trying to understand how to better inform the process. Yeah, I see a new face.
This guy.
Y'all probably wondering, what in the world is he doing here? It's either this or mow the grass. So.
We're glad you're here.
Dale McKeel, Durham resident. I've got 4 different points I want to discuss briefly. One is that, you know, in order to be successful with Vision Zero, there are a lot of actions that need to take place at the federal level, the state level, and the local level. And at the state level, there is a plan called the 2019 Strategic Highway Safety Plan, which I don't think I'd ever heard of until Brian Mayhew made a presentation to the MPO like a year and a half ago. It's a really good plan. It's got a lot of detail. It's got a lot of action recommendations. It's got timeframes associated with those. I think all the actions were recommended to be completed within 5 years, which this plan has to be, it's a federal requirement. It has to be updated every 5 years. Unfortunately, not as much progress has been made on implementation as could have been made, and there, I'm sure, are good reasons for that. Some of these recommendations require legislation and different things, but there's a committee called the Executive Committee for Highway Safety that is responsible for monitoring the progress on this plan. They meet 2 times a year. I'd like to encourage the MPO to work on implementation of this plan and to try to encourage that. And NC MPO does have a seat on that executive committee for highway safety. So perhaps that's one way of doing that, getting more involved in implementation of what is a really good plan. The second point I'll focus on just a little bit. It's already been mentioned a couple of times about the safe systems approach and safe speeds. I mean, I think that's the real core of what we've got to do to improve safety on our roadways. And I would just encourage you, like in section 4.4, where it says action plan needs to specifically mention safe systems approach. I don't think it's mentioned there specifically. The third point is to incorporate Vision Zero into all the transportation processes that we currently have. A lot of changes to our roadways are made as requirements of private development and some public development too. And the TIAs that we're currently doing, at least in some of our jurisdictions, are primarily focused on motor vehicle capacity. What are the changes we need to make to improve the level of service for intersections, for example. But recently, the Institute for Transportation Engineers came out with a recommended practice for multimodal traffic impact assessment. I'd like to suggest that would be one way of focusing more on the safety of all modes as part of the development process. And then there's also a research project, NCHRP 928, which has something called the 5 method. That's a way to look at systematically assess the bicycle and pedestrian quality of service in intersections and interchanges. And it's meant to be a relatively easy process, and I think it could be a useful tool just to make sure we're not missing things. And if there are areas that are yellow flags or red flags, to try to figure out a way to mitigate those impacts. And I'm not implying that staff are not doing these things today as far as incorporating safety into TIAs and into development improvements, but I think would be helpful to institutionalize and document the practice. The fourth step is just is increasing transparency in decision making. I think we do a great job with public engagement and informing the public about what's happening with a lot of our transportation decisions. But other times, like with specific intersection changes, like when we're putting up a new signal, a lot of times folks don't even know that's happening until that signal is being installed. There is another process called the ICE, which is intersection interchange control evaluation process. It's actually recommended that NCHB adopt a policy, an ICE policy in this document, but it hasn't happened yet. There has been one drafted. But ICE would provide a consistent, objective, defensible assessment of alternative forms of control and geometry whenever there's a change made to an intersection. There'd be like a short form that wouldn't take hours to prepare, it would probably take 15 minutes to complete, but it would allow the decision makers to document their intersection, interchange design decisions. And it would answer questions from the public about why didn't you consider X, Y, Z type of design? I think currently, as I mentioned, there's really not a lot of transparency in some decision making. There's an intersection at the Garrett and Pickett Road that I go through probably a dozen times a week. There's a proposal to put a signal there. I've asked some questions about that intersection and some alternatives of both City of Durham and NCDOT staff. No one seems to want to answer those questions. It would be helpful if there were an ICE policy in place. There would be something that both staff and the public could document, how these decisions were made and what considerations there were. And also recently, there's a meeting every month that happens between the City of Durham staff and NCDOT staff where they discuss crashes and intersection improvements. And as a private citizen, I asked for if I could get the agenda for that meeting a couple of weeks ago. And first I was told that that was not a public record. When I questioned that, they told me it was a public record and they sent me the agenda. But they also said they may require me to submit a FOIA request each month to get that agenda. So again, and they're also not writing these summaries of the meetings anymore. The reason no longer available. Anyway, and one last thing I did like to point out. If you haven't seen this, there's a new book out. If you have small children, Rhonda loves roundabouts. There used to be a bumper sticker that said, teach a young child to hate the state. This is teach a young child to love roundabouts. This copy is for Sean Egan, as we have young kids. And if 20 years from now, people are saying, they're lifting Durham in the same breath as Carmel, Indiana, or some other place that has lots of roundabouts, and giving this to Sean will probably get that ball rolling. Anyway, thank you very much.
All right, well, unfortunately, we're running out of time today. We have about 1 minute left. There are a few comments in the chat that I wanted to just go through, and I know there might be, are there some folks behind me who have hands raised too?
Why don't we touch on the comments in the chat, and
Okay.
if anybody has additional comments, they can email.
Yes, so at the end of this presentation is my contact information, which get there so that those of you online can see that as well. We are. Okay, sorry, Scott.
No, I just had a couple more slides, and that's, just remember to use compassion when you drive, and that everyone has family and friends who want to see them again. Just by driving safe, you're protecting you and your family and friends, but you're protecting other road users. That's why I'm just use compassion and realize that some people have bad days. And then I just want to say thank you and do have an action item. Once again, thank you, everyone. I mean, I'm going to stick around on the call until this ends, but I want to make sure to let everyone else know that your input that you provided today and your input that you're going to provide throughout the course of this plan is very important and meaningful. And the whole goal here is to come to consensus as a group to have these safety projects that'll eventually be implemented. The plan itself is going to come up, or it's going to have these steps for projects, upcoming projects. But in reality, we just want to make sure that you guys are all on the same page. And then the last thing, we do have an action item. If you guys have any comments that you want to get back, if you can get them back by the end of the month, I know it's really close, it's Monday, but the scope's not super long. The reason is DCHC would like to post this, ASAP. So if we can get the comments back sooner, then we can get it posted sooner. So once again, thank you very much for everyone for joining, and back to you, Colleen.
Thank you. Just really quick. It looks like we had several comments of people saying hi to Dale. You're missed and well loved. Tricia said, similarly, can the action plan require, encourage documenting sidewalk gaps more accurately? Given that some roads are owned by the town, county, city, or NCDOT, it seems there's no one entity to track all of what is or is not available. So maybe DCHC could serve in that role, to connect those pieces. And then, yeah, Apex have created and other communities created maps of sidewalk gaps and costs, which would be incredibly helpful for seeking grants and other funding. Right now, we don't have an accurate view of what those projects and costs are. We need our policies to allow for these changes to take place and not hinder them. I think echoing what something that Dale is saying. A comment from Terry from Walk Bike NC, does Durham PD support the civilian traffic investigators bill that has been ratified to help identify and train officers on crash investigations in an effort to ensure proper reporting of crashes with vulnerable users? Great question. We will look into that.
I can say yes.
Yeah, the answer is yes. Thank you. And then how to reduce speed on streets that become cut through with requirement for connected streets. Thank you, Kathy. And then a comment about the 12th annual Bike Walk NC Summit and a link to that if anyone is interested. And with that, I realize now my contact information is not listed on this slide, but I will make that available to everyone. It's Colleen.McGue, MCGUE at DCHCMPO.org. Please send me comments. We've recorded all of this meeting today and all the comments that were taking place at this meeting, and sincerely appreciate everyone attending and your feedback on this plan. We look forward to working together and partnering with you on this action plan.
Thank you very much.
All right, meeting adjourned. Thank you very much.
Thank you.
Thanks, Jane. Appreciate it.